I'm going to switch briefly and talk now about how we currently use personalized cancer therapy in a couple of common diseases, breast cancer and colorectal cancer. Let's talk about stage 2 colon cancer. Stage 2 colon cancer occurs in about 1/3 of all people who undergo a colonoscopy for either screening, have a diagnosis of cancer for screening purposes, or have symptomatic either bleeding or abdominal pain. It is an early stage of colon cancer where the tumor has not gone to lymph nodes. And it's a little bit of a therapeutic quandary. Why is that? Well, if you look at the curve here on the right, on the left, and you see the top half of that, if you take chemotherapy, that's that top green line, you have only about a 5% improvement in your survival. What does that mean? It means that for those on the bottom line, we are over-treating about 70%. It means that those who are going to die anyway after taking chemotherapy, we're under-treating about 25%. And it means that we are failing therapy. We are failing patients 95% of the time, because most of what we do doesn't really matter because they're going to do well anyway. And in that 30% who are going to reoccur, we only affect improvement by about 5%. We need to find a better way to determine who needs treatment in stage 2 colon cancer. Well, we have that answer, part of that answer. In 2009, at the ASCO meeting in Orlando this year, we now have developed a reoccurrence score for stage 2 colon cancer that will be able to predict someone's likelihood of developing recurrent disease in the next 5 to 10 years. And this is what these curves show. The larger your recurrence score, the higher the likelihood of reoccurrence. So if you had a reoccurrence score of around 10, your likelihood of reoccurrence in 3 years is only 3 to 5%. You would never take treatment for that. If you were higher up in these curves, however, and you had a reoccurrence score of 50, and say you had additional pathologic features like a T3 tumor, you would have a 30 to 20% likelihood. You probably want to take some chemotherapy for that. So we are now going to be able to use genetic data plus some clinical data to model recurrence for patients who have early stage colon cancer.